Dear, good morning. How are you? Well, as always, it is a pleasure to be here talking to you in our health and wellness space. I want to talk about a topic that I am very passionate about, which is the issue of urinary incontinence. Most of the patients that I see with urinary incontinence are male, but it is an important topic because it is an issue that as we age and our life expectancy has increased, it is estimated that even adults over the age of 70, a large percentage, almost 50%, will have urinary incontinence loss and will require some type of diaper or protection for the rest of their lives. So it is an important issue. It is an issue to which I pay a lot of attention because I am convinced that even if we take measures during our adult life, we can contribute to a better aging where we do not have to suffer from these pathologies. It is a subject that I am passionate about, even the process of developing diapers. I see patients coming in and they've invented ways to protect themselves by adding an extra towel, by flipping the diaper, because unfortunately, I'm sure there are still not or have not been developed the right diaper. And of course, the diaper is not the ultimate solution. The solution has to do with exercises, with improving surgical techniques, with a much more complex issue. But in fact, when we talk about urinary incontinence after prostate surgery, it is a problem because most patients are continent, and it is the event of the surgery that suddenly starts to affect them, and they begin to have urine loss. The loss of urine after prostate surgery, mainly after surgery for prostate cancer, is a complex issue that depends on several factors. It depends, of course, mainly on the type of surgery and the extent required according to the cancer to be performed. But it also depends, of course, on the patient's weight. Patients with obesity, especially significant obesity, higher abdominal pressure, and there may be greater urine loss. It depends if the patient has had previous prostate surgery or previous radiation to the prostate. It increases the risk of incontinence after surgery. And of course, it depends on the technique and it depends on the surgeon, on the surgeon's expertise, dissecting and preserving the sphincter. Assuming that these phenomena are controlled and that in some way he has chosen his best surgeon, the surgery is generally performed with a robot with great precision. The weight issue has been controlled. It is very important, and I had mentioned it in a previous program, the need to train the pelvic floor exercise. When the catheter is removed, there is a significant percentage of patients who are already continent by the time the catheter is removed. However, it has been reported that even up to 2 years later, up to 1 year after surgery, there are still 20% of patients who use some kind of protection for the urine leakage condition. However, it has been reported that even up to 2 years later, up to 1 year after the operation, there are still 20% of the patients who use some type of protection for the urine issue. So it is very important to start the exercises early, even before the surgery. And these are the famous Kegel exercises. These are the perineal floor contraction exercises. And not just doing the exercises, the issue that I specifically wanted to help motivate them to do is that it is very difficult when we tell the patient to do the exercise and the patient just does not see an objective numerical way of whether they have improved or not. Basically, counting diapers is not objective, let's say, for something as precise as subtle changes and improvement that he can't see, because the patient keeps changing a diaper so he doesn't get to see the change. He spends many weeks changing 1 or 2 diapers a day. So what we insisted on, and in fact we created an app that is on the web called DryRevival. Basically the idea is to keep a voiding diary, to keep a record of the amount of fluid that I am ingesting, the amount of urine that I am able to urinate in the bathroom, and the amount of urine that falls into the diaper. And this allows me, I don't have to do it every day, but if I decide to do it once a week, for example on Sundays, all the urine that you are going to urinate, you do it in one of these urine containers, and there you can write down the amount of urine that you have accumulated during the whole day. Every time you urinate during those 24 hours, you do it in that container, and you write down every time you urinate how much you urinated. Then everything you drink, all the liquids, you take another glass that also has measurements, and you write down everything you drink, whether it's coffee, water, you write it all down in this glass, and you write down every time you drink at 9 o'clock in the morning how much you drink, and you write it down. And then, very important, then you take a digital scale like this one. These are the scales that you use to eat. I like this one because it has this reservoir, like a curve up here where you can put the diaper. And the idea is that you put the empty diaper, the dry diaper, so you know how many grams the dry diaper weighs, and then you put the wet diaper. You take it off at 10 o'clock in the morning, you take the diaper off, put it on the scale, and you're going to write down on your little piece of paper how much the wet diaper weighs, and you're going to subtract how much the dry diaper weighs, and that's the amount in grams that you've lost of urine. That, what we are doing today, is that this is going to be taken to an app, an application that you can see on your phone, or you can do it on your computer, and you can keep that record. This is a free app that we have created, and you can put this information in. Every time you drink water, you go into the app and enter the amount. The app knows the day and time you are doing it. Likewise, every time you urinate, you write it down. Every time you weigh the diaper, you write it down, and the app knows the day and time you did it. This will generate some curves that will allow you to know the weekly evolution, and this information can also be sent to you. And you can also send this information to the attending physician by email, and he can have these curves. When you go to the doctor's office, he can see once a week if you are losing less urine. It is not that I am still in the same diaper, no, but you can see that there are subtle losses. For example, you went from 70 cc to 50 cc. You are not going to know that because you are still wearing the same diaper. But the idea is that you can identify these leaks so that you can feel stimulated to continue doing the exercises. And that feedback will allow you to realize that if you are doing the exercises, you are improving your urine leakage. Additionally, in this app, you can download the instructions on how to do the exercises. You can watch videos of how to do the exercises that will help you. Of course, it is important to attend a consultation with us. We send patients to pelvic floor rehabilitation, where a specialist in rehabilitation therapy orients and guides them. Sometimes they need to do biofeedback, that is to say that they place electrodes and verify whether or not they are doing the exercises correctly. However, here we try to give you a practical and clear way of doing the exercises so that you can do them correctly, and that is what we recorded in the previous episode of how to do the Kegel exercises, because these exercises have shown that they will definitely help you recover much faster from urinary retention, because we understand that this is a serious problem that affects your quality of life. But we want you to understand that if you do the exercises, you will recover much faster, and that in most cases, if the surgery was done in a proper way, if you control the issue of urinary containment, you will be able to recover much faster, and that in most cases, if the surgery was done in a proper way, if you control the issue of urinary containment, you will be able to recover much more quickly. If you control the overweight issue, you should recover urine control. If you don't recover immediately, you will recover very fast. So stay optimistic, stay connected here with this app. We will have more control and more feedback of how your progress is to help you out of this situation and solve it as fast as possible. Additionally, there is evidence that these exercises can help to improve, not to develop the erection, but to improve the quality and time of the erection, so it is definitely interesting to do them. This app, of course, will be useful to keep track not only for post-operative men, it will be very useful, and we are going to create a much more personalized one for women, but it will allow to keep in a digital form the famous Mixonal diary. So I hope this information and this app that we have developed with so much enthusiasm and so much methodology will be very useful for you. So well, until a new episode, thanks for being here.